5 medical tests seniors over 70 should carefully question before doing. Aging brings wisdom, but it also brings more doctor visits, more prescriptions, and more tests. Many people over 70 are told to just follow routine screenings without ever being told that some of these tests may no longer help, and in some cases may even cause harm. This creates quiet confusion and unnecessary fear. The truth is, not every test is always needed at every age. Some may lead to stress, false alarms, or treatments that the body no longer benefits from. Knowing which tests to question can protect both health and peace of mind. If this message feels important, take a moment to support it. Subscribe to the channel, like this video, and share it with someone who may need this guidance. A simple step today can help protect health, reduce unnecessary worrying, and bring more clarity to important medical decisions in later years. The PSA test for prostate cancer is often performed automatically during routine checkups in men over the age of 70 without a detailed discussion about whether it is still necessary at this stage of life. While this blood test can detect early signs of prostate cancer, many experts now explain that it frequently identifies very slow-growing cancers that may never cause symptoms or affect lifespan in older adults. Some doctors warn that this can lead to overdiagnosis, where a condition is found but would never have created real harm once an elevated PSA level is detected. It often triggers further testing, including biopsies that can be uncomfortable and carry risks such as infection or bleeding. The emotional impact can also be significant, as patients may begin to worry about cancer even when the likelihood of it becoming dangerous is low. Research suggests that many prostate cancers found in older men grow so slowly that they never require treatment. Yet the label of cancer can still lead to aggressive interventions, treatments that follow a positive PSA result, such as surgery or radiation, may come with serious side effects. These can include urinary incontinence, bowel problems, and reduced physical strength, all of which can affect independence and quality of life. Some medical organizations advise that routine PSA screening should be reconsidered after age 70, especially when overall health conditions are already complex, instead of following automatic testing. Many doctors encourage shared decision-making, where the benefits and risks are carefully discussed. Factors such as general health, life expectancy, and personal comfort should guide the choice rather than routine habit. Questioning this test does not mean ignoring health. It means choosing wisely based on what truly supports well-being in later years. A thoughtful conversation with a healthcare provider can help determine whether this screening still offers real value or simply adds unnecessary burden and worrying to an already delicate stage of life. In many cases, careful monitoring without immediate intervention becomes a safer and more balanced approach. Some doctors explain that focusing on symptoms and overall comfort may be more meaningful than chasing numbers that may never lead to real illness. This perspective helps reduce unnecessary stress and allows attention to remain on maintaining strength, mobility, and daily ease. Making informed choices about testing can protect both physical health and peace of mind during the later stages of life, where balance at use of mammograms for breast cancer screening after the age of 70 deserves careful consideration, especially when they are continued automatically without reviewing individual health needs. Many doctors explain that while mammograms have been effective in detecting cancer early, the benefits may become less clear in older adults, particularly for those living with other medical conditions. Research shows that some breast cancers found at this stage grow very slowly and may never affect overall lifespan or daily well-being. However, once something unusual appears on a mammogram, it often leads to additional imaging, repeated scans, or biopsies that can be physically uncomfortable and emotionally draining. Some doctors warn that this cycle of testing can create ongoing anxiety, especially when results remain uncertain or inconclusive. For many women over 70, the stress of repeated appointments and waiting for results can weigh heavily on mental and emotional health. There is also the possibility of overdiagnosis, where a cancer is detected but would not have caused harm during a person's lifetime. In such cases, treatment may not extend life, but can still introduce side effects that impact comfort and independence. Some medical organizations suggest that decisions about continuing mammograms after 70 should be based on personal health status rather than routine schedules. Factors such as mobility, existing illnesses, and overall life expectancy play an important role in determining whether ongoing screening is truly beneficial instead of following a fixed pattern. Many doctors encourage open conversations where risks and benefits are clearly explained. This approach allows each woman to make a decision that respects her comfort, priorities, and sense of well-being. Questioning the frequency of mammograms does not mean ignoring health concerns, but rather choosing care that aligns with the body's changing needs. A more thoughtful plan can help reduce unnecessary stress while still protecting health in a balanced and meaningful way. Some studies indicate that the likelihood of finding aggressive breast cancer decreases with age, while the chance of false positives remains. These false alarms can lead to further testing that may not provide real benefit but still carry risks. For this reason, some doctors recommend spacing out screenings or stopping them altogether when overall health is fragile. The goal is not to reduce care, but to focus on what truly supports comfort and dignity in later years. This kind of decision is best made with clear guidance and careful thought. Colonoscopy for colon cancer screening becomes a more complex decision after the age of 70, especially when it continues as a routine procedure without careful reassessment. This test is known for its ability to detect and remove polyps before they turn into cancer, but it is also invasive and requires preparation that can be physically demanding. Some doctors explain that as the body ages, the risks linked to colonoscopy, including bleeding, dehydration from preparation, and complications related to sedation, begin to increase. Research suggests that after 70, and particularly beyond 75, the overall benefit of routine colonoscopy starts to decline for many individuals. This is partly because colon cancer often develops slowly, and many polyps found in older adults may never grow large enough to cause harm within their lifetime. Despite this, once a polyp is detected, it often leads to removal and follow-up procedures, which may not always provide meaningful health benefits but can still carry risks. The preparation process itself can be challenging, involving dietary restrictions and strong laxatives that may lead to weakness or imbalance. For older adults, this can increase the risk of falls or discomfort even before the procedure begins. During the colonoscopy, sedation is commonly used, and some doctors warn that older patients may be more sensitive to these medications, leading to confusion, delayed recovery, or other complications. Some medical organizations now recommend that decisions about continuing colonoscopy after 70 should be individualized rather than automatic. Factors such as overall health, mobility, and life expectancy play an important role in determining whether the test is still useful. For individuals with existing health conditions, the stress and potential complications of the procedure may outweigh the benefits of detecting slow-growing changes instead of routine scheduling. Many doctors encourage a more thoughtful discussion about whether further screening is necessary. Questioning continued colonoscopy does not mean neglecting health, but rather focusing on care that supports comfort and safety. A balanced approach can help avoid unnecessary procedures while still respecting the importance of monitoring health in a way that fits the body's current needs. Some studies highlight that the likelihood of serious complications from colonoscopy increases with age, while the chance of finding aggressive cancer remains relatively low in certain groups. This has led many healthcare providers to reconsider the value of repeated screening in later years. The goal is to ensure that every test performed offers real benefit, rather than exposing older adults to risks that may not improve their quality of life. Bone density testing is commonly used to measure bone strength and estimate the risk of fractures. But relying too heavily on repeated scans after the age of 70 may not always provide meaningful benefit. This test can show whether bones have become thinner over time, yet some doctors explain that the results are only one part of a much larger picture. In older adults, factors such as balance, coordination, muscle strength, and history of falls often play a more direct role in determining fracture risk than the scan alone. When bone density results show low values, medications are often prescribed to strengthen bones and reduce the chance of fractures. However, some doctors warn that these medications can come with side effects, including digestive discomfort, joint pain, or in rare cases, unusual bone complications. For individuals who may already be managing multiple health concerns, adding new medications based only on scan numbers can increase overall burden without always improving daily quality of life. Research suggests that small changes in bone density over time do not always lead to significant differences in actual fracture outcomes. Despite this, repeated testing can create a cycle where minor variations in results lead to increased worrying and further medical interventions. Some patients may begin to feel fragile or fearful after seeing declining numbers, even when their physical ability remains stable. This emotional impact can affect confidence and independence, which are important aspects of well-being in later years. Medical guidance increasingly emphasizes that decisions about bone health should not rely solely on skin results. Some doctors recommend a more balanced approach, where the need for repeated testing is carefully evaluated based on overall health, mobility, and personal risk factors. In many cases, frequent scans may not change the course of care, but can still lead to unnecessary concern. Questioning the over-reliance on bone density tests does not mean ignoring bone health, but rather understanding that numbers do not always tell the full story. A thoughtful discussion with a healthcare provider can help determine whether further testing will truly guide meaningful decisions or simply repeat information already known. Focusing on the bigger picture allows care to remain supportive, practical, and aligned with the body's real needs during aging. Some studies also indicate that fracture risk prediction improves when clinical factors are considered alongside bone density rather than using the scan alone. This reinforces the idea that over-testing without context may not lead to better outcomes. Reducing unnecessary scans can help limit anxiety and avoid treatments that may not be essential. Allowing attention to stay on maintaining comfort and stability, full-body screening scans, such as CT or MRI, are sometimes promoted as a way to detect hidden diseases early. But using them routinely without symptoms can lead to more harm than benefit in older adults. These scans are highly sensitive and often pick up small abnormalities that may never cause illness or affect daily life. Some doctors explain that these findings, often called incidental findings, can create confusion and concern even when they are harmless once an unexpected result appears. It usually leads to additional testing, follow-up scans, or even invasive procedures to investigate further. This process can become a long chain of appointments and uncertainty, where each step brings new questions rather than clear answers. Research shows that many of these follow-ups do not improve health outcomes, but can increase emotional stress and physical burden. For seniors, this repeated cycle can feel overwhelming and may reduce overall sense of well-being. CT scans also expose the body to radiation, and while a single scan carries a small risk, repeated exposure over time may add up. Some doctors warn that unnecessary imaging should be avoided when there is no clear medical reason, especially in older adults whose bodies may be more sensitive to such effects. MRI scans do not use radiation, but can still lead to the same issue of detecting harmless changes that trigger further testing. Another concern is that full-body scans can lead to overdiagnosis, where conditions are identified that would never have caused symptoms or required treatment. Despite this, once something is found, it can be difficult to ignore, and many patients feel pressured to pursue treatment or monitoring. This can introduce new risks, side effects, and emotional strain without clear benefit. Medical experts often recommend that imaging tests should be guided by specific symptoms or clinical concerns rather than used as routine screening tools. This approach helps ensure that any test performed has a clear purpose and a higher chance of leading to meaningful action. For older adults without symptoms, routine full-body scans may offer reassurance at first, but they often create more questions than answers over time. Questioning these scans does not mean avoiding care, but choosing it carefully. A thoughtful discussion with a healthcare provider can help determine whether imaging is truly needed or if it may lead to unnecessary worrying. Focusing on tests that are clearly linked to symptoms allows care to remain practical and supportive, reducing the risk of overtesting and helping maintain peace of mind in later years. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.